Okay, one more second and we'll be ready to go.
Yeah.
Okay.
All right, good morning, everybody. Welcome. We're so happy everybody's been able to join us today on what is hoping to be a very positive and exciting time, and certainly timely getting to hear from Dr. Caldwell today. Before we jump in, I wanted to take a moment and thank our sponsors, as always, who've been so generous to help us bring you this kind of programming, and without whom we couldn't do some of the fantastic work the Chamber's been putting out lately. And it's been really exciting to get such great feedback on the programming lately. Take a moment to recognize our community leader sponsors, Nashville Christian School and NHC Place at the Trace. Our community champion sponsors, Seven Springs Orthopedics, Regions Bank, and Parkside Builders. And our community advocate sponsors, Y Smart Digital, Westgate Commercial, Clarendale Bellevue Place, and Temple Hills Country Club. We hope that several others of you will consider joining us and sponsoring at these levels to continue this kind of programming and this kind of great exposure for your businesses and your connections to the community. I'm really thankful for everybody who's put together the program today and the time that Dr. Caldwell has given. So I'm looking forward to it. I'll turn it over to Amy to handle the next bit of business.
Thank you, Jim. Appreciate you so much for all of the leadership you've shown for the Chamber during an especially difficult time in our history. And things are going very well. We're happy to have you guys here with us. And thanks again to Dr. Caldwell and to all of our sponsors and volunteers. At this time, I would like to take a moment to recognize one of our most special sponsors, Nashville Christian School. Nashville Christian is not only our community leader sponsor, they are also a platinum sponsor for our Chamber Heroes program. And today we have Jeff Brothers, who is the Director of Operations for Nashville Christian School. Jeff is going to take a few moments to tell us what's going on at NCS. And Jeff, take it away.
Thanks, Amy, and thanks, Jim, and I hope everybody can hear me all right. We are very excited at Nashville Christian School to continue our partnership with the Bellevue Chamber. Such a great program and such a great opportunity for us to get together with all of you guys and ladies that are such a vital part of the Bellevue community, a growing Bellevue community, an exciting time out here in West Nashville. And Nashville Christian School has been here a long time, and we're excited to continue providing an opportunity for Christian education here in the west side of town. And Nashville Christian School, our mission is to be a Christian, authentic, and dynamic school that equips our students to be global leaders. And what a great time to have that as a mission, you know, with all the challenges that we're facing across the country and our community and at every level, to be outspokenly Christian, authentic, and dynamic. We recognize that we're going to have some things to work through, and we're committed to doing that with our foundation in Scripture. We do partner with the Bellevue community to sponsor the Bellevue Picnic, to be the lead community leader sponsor, and we also host when we can, and we're going to be able to again very soon, the Breakfast Before Business here on our campus, which is a great opportunity for us to meet and greet you guys and let you see what Nashville Christian is about. We are pre-K all the way through 12th grade, so we call it cradle to college. We have 235 preschool students. We have 595 K through 12 students, and we serve students on all learning levels. So anybody that has a demonstrated need, learning difficulty, we can address that in most every case, all the way up through students who aspire to go to schools and have been accepted to schools like Johns Hopkins University and University of Chicago, and really just go, you know, through the roof academically with their curriculum. We're also involved in TSSAA athletics. We're excited to be playing sports right now. I know in a lot of places that that has been a challenge, and for us, we're excited to still be competing and to provide that opportunity for our students. We have a tremendous fine arts program, and the spiritual life of our school is thriving. We look forward to opportunities to go out into the mission field once that becomes available again, here locally, domestically, and even across the globe. Right now is a challenging time, and we have to do a lot of things that follow the CDC guidelines and protocols for us to be able to have a school here on our campus. And we're excited to see our students every day, to engage actively in their learning, and to provide that opportunity here in West Nashville. And we have, I think, several dozen zip codes represented in our school community, and more people every day inquiring about Nashville Christian Schools. So we look forward to having you guys here on campus. I look forward to meeting the ones who I haven't met yet. If you ever have any questions, feel free to call. But Amy and Jim, we're just super excited for our continued support of the Chamber and our membership as well.
Thank you so much, Jeff. We are just so appreciative of your partnership and everything you guys do for the Bellevue community. And thank you so much for being with us here today and for letting everybody know what you guys have going on at NCS. At this time, I want to make a few announcements. We are going to have time at the end of our meeting for some questions and answers with Dr. Caldwell. And what we would like to do is have you post a question in the chat box, and we will get to those at the end of the meeting. At this time, I want to turn over the meeting to Zach Heil, who is on our board of directors and who is the team lead for speakers for our events. Zach, thank you so much for the work you've done today on this event, and I'm going to allow you to introduce Dr. Caldwell for us.
All right, thank you, Amy. It's with great pleasure that I get to introduce Dr. Caldwell, the Nashville Director of Public Health and Chief Medical Officer, who's joining us today, kindly taking time out of his day to come speak with us. Dr. Caldwell is a seasoned public health leader who currently serves as the Nashville and Metro Davidson County Director of Public Health and Chief Medical Officer. He joined the department in early March 2020, just as the devastating tornado hit the city and we got the first case of coronavirus in the city. He leads a department of nearly 600 staff, serving a population of nearly 750,000. Dr. Caldwell served for 19 years as the Commissioner of Health for Dutchess County, New York, which is the home of Franklin and Eleanor Roosevelt. While there, he managed a staff of 180 employees, a budget of $40 million. He was the president of the National Association of County and City Health Officials, and also worked as a resident physician with the ABC's News National Headquarters in their medical unit in New York City. While serving as Commissioner of Health for Dutchess County, he created a clinical investigation drug research unit within his public health department that specialized in vaccine research, including vaccine research studies for HIV, hepatitis, Lyme disease, herpes, seasonal and pandemic flu, and the HPV vaccine. He is nationally recognized for his work on tobacco control and emergency preparedness, as well as vaccine research, development, and policy. He has testified to Congress numerous times on pandemic and emergency preparedness. His recent experience as a professional in the biotech industry, serving as the Director of Scientific Affairs and Public Health Vaccines for GlaxoSmithKline, where he focused on adult vaccination, including the newly approved shingles vaccine. He's a graduate of Columbia University, an internal medicine physician trained at the Mount Sinai Medical Center with a master's of public health from Harvard, and he completed a preventative medical residency program at the State University of New York. He is licensed to practice medicine in the states of New York, Pennsylvania, and Tennessee. He is definitely qualified to talk with us today about what he's going to talk about. So without that, welcome, Dr. Caldwell. I'll turn it over to you.
Thank you so much. It's a pleasure to join you. Just give me a thumbs up. You can hear me okay for that sound check. All right, that's great. And what a great day it is for Nashville with the announcement today that the Titans are going to be able to have fans. I have a lot of great news to share with you today. I'm going to share my screen right now. I have a presentation that I'd like to go through with you and give you sort of a walk through what has been our last 6 months, and to sort of put into perspective today's announcement, and really looking forward to hearing your questions and answers. I want you to know that the Nashville Public Health Department is here for all of you as individuals, families, communities, businesses. We want to partner more closely with you, and not just for COVID, but for a whole wide range of things. Public health really lives in each one of us every day. And as business owners, you have the ability to help forward public health objectives through your actions with your business, with your workers, and all you touch in the community. So we're all in this together. So I'm going to right now share my screen, and I'm going to see if this opens up for you. So let's see for that thumbs up again. Looks good. You can see the screen. And there you go. If you follow Twitter, you can reach me at @HealthChief. And the Department of Health, the health department is at Nashville Health. And there's a great way to get to the home page, health.nashville.gov. And look at that beautiful picture of the health department sort of at sunset. It's a beautiful building. It's been around 6 years. We're at 2500 Charlotte Avenue. We, on regular times, have wonderful community facilities where conference rooms that numbers of the community can use that. So keep that in mind if you ever need to get together in the Midtown area, 2500 Charlotte Avenue. This is a building for all of you. So Tuesday, March 3rd was a really important day for a lot of reasons. It was this devastating tornado. I had moved to Nashville probably in about 1.5 years before this. So I've been in Nashville about 2 years now. I was continuing my work in biopharma here. My wife's family is from Camden, Tennessee, in Benton County. So she came down here having recently finished law school. She works at Elder Law of Nashville now. Her name is Shannon Lashley. So I came down to Tennessee and Nashville for her. And when I learned that the Director of Public Health position had unexpectedly opened at the end of last year, I was encouraged to apply. A number of my colleagues knew I was in the area. And so I was asked to take on this role at the end of February by the Board of Health. I report to the Board of Health and, of course, work very closely with the mayor and the rest of Metro government. But so Tuesday, March 3rd was actually my scheduled orientation day. My first day was not till March 9th. But this Tuesday, March 3rd at 10 a.m., I was scheduled to be meeting with the acting director of health to start, getting my footing, knowing I'd be starting the following week. But plans would soon change. This is what we were greeted with that day, and I immediately knew that this would offer me an opportunity to get to see public health at work in disasters like a tornado. I knew COVID was on the horizon. So although the Department of Health orientation meeting didn't go through, I asked to be an observer at the Office of Emergency Management, the Emergency Operations Center. So immediately got to see the health department staff that was part of our public health emergency preparedness, working hand in hand with Chief Swan and the fire and EMS and all the other agencies across Metro that were in the Emergency Operations Center, trying to identify the damage from the tornado and work immediately on recovery efforts. So from there, I immediately started to get to know the mayor. So this is March 3rd. So 2 days later, I've been now in the Emergency Operations Center probably at least 12 plus hours a day, still as an observer. But so 2 days later, Governor Lee, and here to the left is Dr. Piercy, the state health director, announces the first COVID case in Tennessee. Now, the mayor, Mayor Cooper, was having a press conference shortly after this and asked, even though you haven't started yet, would you mind joining me for this press conference to talk about this COVID thing? So I said, well, sure, I'll be happy to. And so we were kind of, as I say, off to the races, but it really was just the beginning, because then on Sunday, March 8th, now still the day before my official start date, here we are in that beautiful Lentz building I told you in the lobby, with Mayor Cooper. And then you see just behind Mayor Cooper, Dr. Jahangir, who at the time was only the chairman of the Board of Health. His role would soon expand shortly thereafter this. Me, Chief Swan, Dr. Battle, and then all the way to the left is the Tennessee State Department of Health epidemiologist, John Dunn. This was now announcing our first COVID case in Nashville. And I believe one of the very first cases that came into Tennessee was a result of a medical conference in Boston, a Biogen conference, where there were many dozens and hundreds of people infected there, and a number of people were at that conference from Tennessee. And we know that was at least one of the first identified cases. So here we are, Sunday, March 8th. And I had done a tour of the warehouse where we have a lot of supplies for public health emergencies, and I identified that we had these portable sinks. So I immediately recognized an important visible symbol to have at these press conferences. So I did what I do. I tell people to don't shake hands and start washing your hands, and immediately did these demonstrations as much as I could with the hand washing stations that we kind of carted around wherever we could go. And of course, yeah, we're joking with each other, elbow bumps at the time. I remember being in the first press conference with the mayor suggesting that we should stop shaking hands. And this was around the time, of course, you know, President Trump came to the area to tour the tornado areas. I even put a call in to the CDC to ask if President Trump would maybe hopefully try not to shake hands. Now, this was back in March, of course. I'm not sure if that message got to the president, but nevertheless, we were working hard to at least get into the understanding that we needed to start behaving differently. So this was the first official elbow bump that the mayor and I had in public. So now let's go to that Friday. The following week, cases are starting to grow and escalate. We see what's going on in Italy. We're being very concerned that we need to act quickly. So Mayor Cooper on this Friday, March 13th, announces the creation of the coronavirus task force. He asked Dr. Jahangir to chair it, and it is composed of most of the CEOs of most of the major hospital and academic medical organizations. And this is in our Board of Health room on our 3rd floor. And as you could see here, you know, way before any masking or really much social distancing. But this was an important sort of bringing together of the infrastructure of what would be the coronavirus task force. So what happened right after this day when Dr. Jahangir became appointed the task force chair was a Saturday, March 14th, was a very critical day because across the country, people saw images like this on social media, real concern with what I now call the fearsome 4, which is how COVID is transmitted. So that is indoor as opposed to outdoor, no face masks as opposed to wearing face masks and having it be enforced, no social distancing, and then adding alcohol all together to have a very sort of COVID-friendly bar atmosphere. So once this was seen, it was felt that on Sunday we needed to have an emergency meeting of the Board of Health. The mayor asked that the Board of Health declare a public health emergency on this Sunday, March 15th. So once again, putting into perspective, this is still just the conclusion of my first week. And I felt that while this was an emergency and it was new, I was prepared because of my background and experience. You know, COVID might be new, but emergency preparedness and running a health department was something that I was very familiar with. So I did feel really gratified with my own background and training, and also the fact that we have such a strong infrastructure of healthcare institutions. We are the healthcare capital of the country, or so-called, and we have a really great public health department. Nashville Health Department is really very strong, very rich. And I knew it had all the ingredients we needed to get through this time. So that was Sunday, March 15th. What did we do at that time? The first thing we did was just to shut things down by half. So this was something that was done before any action at the state level, and was something that we were seeing very rapidly happening across the country. So we limited restaurant seatings to less than 50% capacity with no more than 100 individuals in any given establishment. We limited bar service at restaurants to about 50% capacity with no standing allowed. This is very similar to what the mayor just announced today, what we're going to go back to as of tomorrow. So although as the director of public health, I had the ability to make these health orders at any time I deem that there's a public health emergency, to have the Metro Council, the mayor, the governor, the president, and the local board of health sort of reinforce these emergency declarations all makes it much easier for us to proceed and to defend any challenges in any courts with any judges. So yes, some people were not happy with what we were trying to do, but just also to put in perspective, I could understand why people were saying, well, you have so few cases, why are you doing this? And look, as of that Sunday, March 15th, we only had 39 confirmed cases in the entire state of Tennessee, only 17 in Davidson. To put that in perspective, we announced many more cases than that now every day. But we felt that we were at a blind spot, that we really weren't doing testing, that it was probably a lot more prevalent than we realized. And we also knew that if we could hit it quickly and hit it hard, we might be able to sort of expunge this virus from our community. And of course, that became very challenging when we didn't have a national plan, and certainly not even a state plan, because what happened is Governor Lee in Tennessee did not start to shut down Tennessee until about 2 weeks after we did. And then, of course, then the governor had reopened Tennessee really before we started reopening. So there was a much narrower time frame that the whole state sort of participated in this ability of us to try to limit people interacting with each other and exposing each other. Just to give you a sense of the kind of things that we did, we very quickly realized that the director of public health, myself, needed to issue public health orders. These are orders that have the same effect of law and are issued because of the public health emergency. So I'll direct you to where you can find these on the website so that you can look at them in more detail and see the path we've charted over the last 6 months. In addition to these public health orders, Mayor Cooper, of course, can issue executive orders. And here's an example of one as well. Before we issued the full mandate of masks across Nashville and Davidson County, Mayor Cooper issued an executive order that stated that anyone walking into a Metro building must have a mask on. So that was something that he was sort of able to do as the CEO of the Nashville Davidson County government, similar to what you could do as your business owners to make your own rules of how your business operates. So there was a real intersection of a lot of different levels of expertise and leaders trying to attack this virus in a few different ways. So now, Monday, March 16th, right after the public health declaration was announced, Mayor Cooper brought together the leadership of the healthcare systems in Nashville. And you could see now the social distancing sort of taking effect here. And we're really lucky. Dr. Jahangir has been now in Nashville for most of he grew up here, and really knows the leaders of the healthcare system so well. Each one raised their hand to volunteer to help us with our testing assessment center sites. And we were trying to roll those out as quickly as we could. So this is just another example of us very quickly springing into action, bringing people together, talking about what the problem was, trying to create an infrastructure, and more importantly, a process that would enable us to understand what was going on, to monitor it, and to decide on next steps, and to keep evaluating those steps moving forward. Here's just another shot of what was really a historic moment for us on Monday, March 16th, what direction we were moving in. And I could say that probably the next time we had these cameras out like this was today in front of the mural at Titans State on Korean Boulevard there. It was really the first time we had sort of a live press conference almost since this time 6 months ago. And of course, I just bring these hand washing stations around with me wherever I go, and always grateful when a photographer takes a picture to try to reinforce that message, because at the end of the day, still washing your hands frequently is so important in addition to everything else that we're doing. So now, a week later, so now we're about a week and a half into this, there's finally that safer at home order. So safer at home was not the first thing we did, it was the second thing we did. And it was 1 week to the day after the initial public health emergency order. This was the one where we really shut down everything, for lack of a better term, very quickly. And we saw this going on around the country, and we were not alone in doing this, but it was Governor Lee and the state of Tennessee kind of following this about 2 weeks thereafter. So our assessment centers are really key to some of the response that we had in the community. We have them now still open. Summer hours are 7 a.m. to 1 p.m. You can go up anytime. You don't need symptoms. Just drive up, say you'd like a COVID test, and you'll get one. They're located at Nissan Stadium in the parking lot. You could go to Meharry Medical College right on the street there, or, as well as the old Kmart on Murfreesboro Road. Those are open 5 days a week, 7 a.m. now to 1 p.m. And what's happening is that we created these with Chief Swan and the Office of Emergency Management, but we didn't have the test kits. We didn't have labs to be able to do the tests. We were ready to roll for about a week or so, and just were kind of waiting for help in trying to get the test kits and the lab set up to move forward. So in some ways, Nashville, we were moving forward faster than there was the capacity to help us to do everything we needed to do. The first death of COVID in Nashville was reported on March 20th. You'll see here now, I note that was April 2nd now, almost 2 weeks later from our order when the whole state went to their safer at home order. I felt it was very important that I mandate something that I could enforce. And initially what was mandated was only that you put a sign on the front of your business to say something to the following here: please help us follow CDC guidelines by wearing a mask in your business. That will help us protect our employees and each other. So the initial mandate was just put signage up to get people to try to wear the face mask. And then also we mandated that your employees should wear the face covering if they're interacting with the public. We wanted everyone to wear it, but we really didn't have a way to properly, I think, either get the public to start wearing face masks 100% or to do it in an enforcement way. And we were seeing examples around the country where there were face mask mandates that either weren't enforced or there was some social unrest or violent episodes that we really did not want to recreate here. So we're very sensitive to trying bringing the community along, educating them, seeing what was going on around the rest of the country, and also taking into account the culture of Nashville and Tennessee, to be able to get people to believe that wearing a face mask is something that was helpful. So just like the rest of the country, about 30% of people who are in our area and who work in our government kind of believe it's not real or a hoax and all this. So we have to even educate some of our own staff in our community, less so in the health department as opposed to in other departments. But the fact of the matter is that that continuum of people's belief system doesn't sort of stop at the door of Metro government. It's all throughout our community, and we needed to be mindful of that as we were trying to ask the community to make differences, and we were trying to ask other agencies in Metro to help us with enforcement of some of these regulations and laws. So first thing, mandate the sign, and that was actually a big deal initially for us to do. I felt it was really important that we provided signs if people wanted to use, but each business, if they wanted to use their own logo or create their own sign that worked better for them, as long as it was visible and told the story, we felt it wasn't necessary to mandate a specific sign, just the type of language or what your information you're trying to communicate to the public. Here's our Nashville website for COVID. You can get it at two different ways. If you look on the upper left here, you'll see it's asafenashville.org. Also see the mayor talk about covid19.nashville.gov. So either one will get you to this homepage. And once I conclude my PowerPoint, I'll get on live to show you what it looks like today. These are some screenshots from a number of weeks ago, just to give you a sense of what the pages look like. The public health orders, see these buttons here. One of the buttons will say public health order. I think it didn't make this screenshot, but if you click it on, the public health orders are there in reverse chronological order, so you could see what the latest one is and how it changed over time. We also had this roadmap for reopening Nashville. If some of you have looked at this and are trying to compare the original roadmap to where we are now, I'd just say look at this more as in a historical document now, because these phases were something we outlined early on of what we sort of had intended or thought. The mayor announced today we're moving to this new phase 3 now, but as we've learned over time how to do things, what was it, our initial thoughts in these roadmaps has sort of shifted. So just to kind of keep that in mind, that you look at more of the newer information rather than trying to compare it with any older information, because it is sometimes confusing and even contradictory. This was just another example how we evolved from mandating the sign to then mandating the face coverings for employees. That was a next step forward. And then in June 29th, we required everyone to wear face masks in the community. And that was an order that the Board of Health passed. I felt I didn't want to do it completely on my own. I also was very concerned that there was still not a clear enforcement plan in place. And that really did not get crystallized until the recent change in leadership at the police department, when now you really see the police working side by side all other Metro agencies and issuing citations, because it's now that threat of enforcement that's really gotten that face mask compliance much, much higher, especially in places like Lower Broadway, where trying to maintain social distancing is just really not possible, especially between the hours of 6 and 11. Another example of Mayor Cooper's executive order. So we have a number of items on this webpage. This should be familiar to you, especially for business owners. We try to provide different resources for reopening for different categories of businesses. And we are here to work with you and partner with you on any issue that may be of concern to your business, your employees, your customers. And I wanted just to use this as a sort of a quick snapshot to tell you that what happened with reopening. We started to reopen May 11th, very limitedly. But once again, if you look here on the left, the governor opened the state up about 2 weeks before we did on April 27th. So we sort of stayed closed an additional 2 weeks. We went from sort of phase 1 reopening into phase 2 reopening, May 25th. That was Memorial Day. That was the day the music came back to Broadway in a limited way after a number of months, March, April, at least 2.5 months, no music on Broadway. It was great to be there at that day on Memorial Day, handing out masks. Keep in mind also what happened on Memorial Day. Memorial Day was Monday, the day that George Floyd was killed. So it was that following Saturday that then we had the marches, protests, and unfortunately riots that also shook us and are still shaking the country. So all this in the context of what was going on at the same time. Well, we had to expand our ability to help our homeless population. The rescue mission and some other places where the homeless would normally go had to shut down. Churches were closed where people would go. A lot of the volunteers at those facilities were elderly and are most at risk of having severe effects or dying from COVID. And so we created space at the Nashville Fairgrounds to allow people who are well, meaning feeling well, homeless, to reduce some of the overflow at some of the other homeless shelters. And this provides a really comfortable, I think, very pleasant, brand new setting in some of these buildings here. And we are always getting very great feedback from our visitors, homeless visitors who are spending time with us there. We have the social services department of Metro overseeing it, as well as partners with St. Thomas and EMS there 24/7 to assist those who need that space. In addition to where the well space is, we have a second part of the building where it is restricted for people who are under suspicion of being sick, waiting for a COVID test, or actually COVID positive. So this is really the only quarantine area that is under Metro control. And when we did have a big number of cases tested from the rescue mission, a lot of them were asymptomatic, but they were positive, and we needed to quarantine them, and they had nowhere else to go. So we brought them to this dedicated facility. And unfortunately, one of the people there decided they wanted to leave and unfortunately was arrested. This is still in the courts now. I just 2 weeks ago had to testify to this because there was a case made by the public defender that this gentleman's constitutional rights were not properly followed. So we're still waiting to see the decision by the judge. So keep that in mind in your news to see how the judge rules on this particular case. But I made the point that I certainly would not want anyone to be arrested, but being quarantined is not a suggestion. It is the law. It is a legal requirement. And for us to sort of state that we're having this quarantine center and you're expected to be there, you're legally required to be there, and just to kind of let people come and go as they want was not acceptable. And we needed, unfortunately, to draw a line. And this was the case, unfortunately, for this gentleman. It also kind of sent a very clear message that if people were not going to wait out their quarantine time, this could potentially happen to them. So there's been really great compliance since then. And we haven't had as many people be quarantined. Just a few more slides, and then I'll go through the web page and then be here to answer your questions, keeping an eye on the time. What has happened more recently is here's an article where I was out assisting the police, handing out masks and really just before the time that they started to issue citations. So as you could see, this headline, partiers ignore Nashville's mask mandate with impunity. And I like the guy on the left behind me here who's got his cigarette out trying to figure out how to put on the mask so without burning himself. So it was about a week or so after this particular article ran that things really changed. We have a really robust infrastructure now led by the mayor and Bob Cooper, Metro Legal, along with the Beer Board, the Transportation Licensing Commission, Fire, District Attorney, Legal, Health, about 11 different Metro agencies meeting every Monday and every Friday, reviewing what has happened over the past weekend, reviewing to plan the next weekend. So we've made a tremendous difference. And one of those differences was my recognition over Labor Day weekend on the Saturday that even though we worked to get extra lane on each side of Broadway, but metal fencing to give people more ability to social distance, that it was inadequate on the Saturday of Labor Day. So I made the recommendation to Mayor Cooper that we try a pilot to close Broadway only between 4th and 5th. And I made that recommendation because it is on that strip where we have most of the bars and restaurants that are open and most of the crowd gathering, most of the problems with people congregating. And this was really a great pilot on the Sunday after that Saturday, a Sunday of Labor Day weekend. And you could see immediately what we chose to do is determine that sidewalks would only be for people who are walking and not waiting on lines. And what we decided was if you were going to be waiting to get into one of the restaurants or the bars, your line would begin at the curb and then it would go straight out to the middle of the street. And just take a moment to look at this picture carefully and see how, when you give people room, how they just sort of more naturally, socially distance with each other. Compare this with an image in your mind of this same crowd kind of crammed against a building, trying to wait online, not to lose their spot, trying to squeeze away from the people walking by the sidewalks, the people on the sidewalks squeezing by the people who are waiting on lines. And this has just offered a really great new addition to at least between 4th and 5th on Broadway. What we're doing is between 4th and 3rd and 3rd and 2nd, those businesses that are still open with lines, we are taking that extra lane with the metal fencing and having the lines go in that part of the street, even though we may not close the whole street. So we're trying to find alternatives to improving social distancing in a lot of different areas. So that is the end of my slides. I'm gonna go now to my just main page here. I'm gonna pull this over. Hopefully you can see now the main page. This is today's asafenashville.org. If you look on the right, you'll see all the different buttons. And one I want to bring to your attention, as I talked about before, the public health orders. If I click it on, you'll see here the September 14th order. Great move by Mayor Cooper for Monday night football. First Titans game to let bars and restaurants stay open to 30 minutes past game time. That was really very successful, especially for the Titans. We also want you to know about this button here, research vaccine volunteer opportunities. Please, if you're so inclined, learn about how the volunteer state, we need volunteers at a number of different COVID-19 research vaccine centers, Meharry Medical College, Vanderbilt University, Clinical Research Associates in a partnership with the health department. I myself and a couple other doctors here are participating with looking for volunteers. You can click where it says here to learn more about it. And then if you want to just look at the national recruitment efforts from the National Institutes of Health, you'll get here as well. we need a diversity of patients. We need a lot of patient volunteers over the age of 65, because that's what COVID is really killing. For the deaths in COVID, 4 out of 5 are people over 65. So we want to make sure the vaccine works in the elderly population. And of course, diversity, the African Americans, Hispanics, and other multicultural communities, they're the ones that are hardest hit by COVID, and they can really, hopefully, do well by a vaccine that works well. So with that, I'll leave this up. I just want to say thank you very much. I'm going to stop sharing now and just show you what we have now, our new sort of brand of public health. You'll see this. If you want to help me sign up, just let me know. We need volunteers between 6 and 10 p.m. on Broadway at the Bridgestone Arena. You'll get a hat, and look at this cool thing on the back. See, it says Nashville Public Health. And we'll also get you this shirt to help us educate people. And look at this. Volunteer Public Health Nashville. How cool is that? Keep us in mind. And now that there are going to be more of these events, we're going to need more monitors at different events. So with that, I'll conclude and look forward to your questions. Thank you.
Thank you, Dr. Caldwell. So we got time to get into a couple questions. So I think I'll try to sum a couple of these into one and just kind of let you talk about it. We got people looking kind of towards the future of, do you see a possible second wave coming? How the flu season could possibly affect that? And if a second wave comes, we've got people that are wanting to hold meetings, October, November. What do you see with that? Is that going to be more of a possibility? And what kind of guidelines do you think people need to be following to meet safely?
Yeah, well, right now, if you go to that asafenashville.org, let me bring my screen back again and show you that page where you can, if you want to have, this is the main page, if you want to have an event over 25 people, you just scroll down and look at this event, planning an event application submission form. You click this on and it'll get you right to our form where you can put your event in there. You can load up documents. All of these events need to be reviewed and approved by us. We're trying to learn and get a seamless system. The mayor will be announcing events expanding. And what we want to do is not shut down everything. We want to open things slowly, and where we believe there's a low risk of COVID, that we're going to want to let those events move forward. For example, Ryman Auditorium, they started at only 5%, 125. The next week, they went up another 5% to 250. This Friday, we'll let them go an additional 5%, 375. Now, I would like to see maybe a ceiling for right now of getting to about 25% capacity and seeing how we can do overall. But this is all, I think, case by case for some of these spaces to see each one. Like at the Titans today, talked about only bringing 10% of their fans in. Now, 10% is 8,000 people for a 70,000 arena, but they've been working very carefully on a plan like that. So we're looking similarly on case-by-case examples of allowing certain events. And that's why we have this system where you can get special attention from the health department. Yes, we expect the numbers to continue to be a problem over time. They'll probably go up and down, but I think we are not going to necessarily go close and open the way we were. We're probably going to do it in a different way. I'm not quite sure how that will evolve, but it will evolve in the way of us feeling comfortable about allowing low risk events to continue, and those higher risk ones are the ones we'll be able to try to clamp down on more.
Okay. We also had a question out there, again, more towards Bellevue. We talk a lot about Broadway and what could expect down there and the huge crowds, and we don't necessarily have that tourism out in Bellevue area. What do you see for like the bars and restaurants and stuff moving forward for us? When do you think, is it going to be possible that we can get full open anytime soon? And what do you see with that maybe?
Well, the mayor announced today that we're taking another step forward by allowing there be a closing time increase till 11 p.m., which should help a lot of the facilities that might be able to get another seating in. It's still have to focus on what your capacity is for social distancing. We are recommending still or require 50% now, and I think most places are feeling comfortable with that. Bars tomorrow are now going to also be able to go to 50% capacity, up to a limit of 50 people per floor. Like, for example, some of the bars, well, Broadway is where I've been spending a lot of my time, but your neighborhood bar now is going to be able to at least double their capacity from 25 to 50. And if they have multiple floors, they could have 50 on one floor, 50 on another floor, and an additional 50 outside. So I think that this is a way that's going to provide some relief, especially for those neighborhood bars. I really also am trying to find ways that we can get people to wear their face masks more often than they are now, even when they're inside. We've given the very clear instructions that if you stand up, you got a mask up, put your mask on. When you walk in, until you sit down, if you have to go to the bathroom, you put your mask on. But I still am not satisfied that I think even while people are sitting at their table, eating and drinking, there's probably a lot more little pockets of time where they could put their masks on. And I think that could make more of a difference. And I just haven't quite settled in on how to do that yet. So if you have any ideas, let me know. But let's think about it. If you're in a restaurant and everybody's seated, eating and drinking and talking, that is a higher risk of COVID spread. There's no doubt about it. But I just, we'll have to see if there's other little incremental ways that we can continue to be a little safer in restaurants.
Okay, thank you. And then we've got a couple questions on just kind of going back in time. If there was anything, now that you know what you know, we're 6 months into this, and like you said, it was new and learning with it. Is there anything you would do differently? Is there anything possibly with like the bars and restaurants opening earlier, or possibly with like closing construction sites, stuff like that? Anything that you would do differently that we can learn going forward?
Yeah, well, I think we would do a lot of things differently, but it'd have to happen in the context of everything else that was going on. Certainly, we would have all been wearing face masks sooner. But then again, I couldn't recommend it, in a vacuum if nobody else was doing it. Yeah, so yeah, there are a lot of things we would have done differently. But I think as a state and a country and as a community to kind of think this through, to process what was going on and get us there, I think, yeah, we would like to continue to just move forward from what we know now.
Okay. And I know we're getting tight on time, Amy, so I'll just ask one more question, and this is being selfish a little bit, asking one for myself. Just your thoughts on vaccines. They're seeing reports out there that even if we get a vaccine, that the population, about 50%, is hesitant to accept that vaccine right now. Just knowing your history of vaccines, what's your thoughts on it, and what do you think would be good for us as general public to go about with that?
I'm very focused now on the safety of these vaccine trials, that we want to assure that these vaccine trials are conducted with the highest ethical and scientific standards. And I want to see what the safety data are first. Then next is the efficacy data, is how well do they work? Of course, a vaccine that is determined to be relatively very safe and has a 90+% effectiveness, the science is so key in driving, I think, people's accepting of the vaccines. We need the scientists and the medical community to believe in one of these vaccines as well, to help drive the community. So a vaccine that is safe and effective, where it's probably going to be more than one, is going to be really important. The medical community's adherence and rapid uptake of it is going to be something to watch carefully. And at the end of the day, even if a vaccine is only 50% effective and only 50% of the people want to take it, it's still going to make a difference as long as it's safe. As long as it's safe, I think the more that we can get safe and effective vaccines out to the community, then we'll just have to, over time, continue to educate people. I'll tell you right now, I was very involved with the shingles vaccine. The new shingles vaccine works really well. And I think the science is really strong, and I think they now have enough of it. So if you're over the age of 50 and you haven't gotten your shingles vaccine yet, look for it. There are 1 million cases of shingles a year. Everyone knows someone that's had a terrible time with shingles. That's just one example. If we could also let people see other diseases where we can make a difference in protecting them, that impact us now. A lot of people like polio, they don't really see that as a problem because it's not visible. Shingles is still visible, and I think we can learn a lot from what people are experiencing now. So we have a long way to go. A lot of people distrust, but I think if we focus on the science and the safety, that will get us in the right direction.
All right. Well, thank you for your time. I know there's some questions we didn't get to, but thank you everybody for joining us. Thank you, Dr. Caldwell. Appreciate your insights. I'm going to turn it back over to Amy for the last few announcements and to wrap up, and go ahead, Amy.
Thanks a lot, Zach. Hey, Dr. Caldwell, I have one quick question. How long does it take for the medical community who's doing research on vaccines to know whether a vaccine is safe or not?
It depends on how much of the COVID is in the area where they're testing the vaccine to see if it works, if it's effective. But safety is something that continues for 2 years. Initially, most of these vaccines are going to be 2 doses, 1 month apart. And you might think an immediate type of reaction where people might get an injection site reaction or not swelling or redness, and then maybe some other effects. But I would say usually probably within 3 months of the initial injections, that's usually a good time that if there are going to be some severe adverse effects that you would see it within that time frame. But we're going to continue to follow people longer term. And also because we expect that there's going to need to be booster doses. This is not going to be just 2 doses and you're done.
Okay, thank you very much. And the phase 3 that you mentioned that Mayor Cooper announced this morning, is the new document going to be put up on the safenashville.org that indicates the new guidelines for phase 3?
Yeah, I guess I need to get to that. So he announced the outline of it. I got to work with our team and our lawyers so that I can sign. You said all those have my signature, so I know I haven't seen. But the outline is the way he described it. It's supposed to take effect at midnight tonight. So we'll have it done before I leave the office today. It should be up there tonight. So that Friday, this weekend, those bars can get a little bit of more relief with their customers.
Okay, well, thank you so much for providing us with that great presentation and for your time. I know you're a very busy person, and we just have a few announcements to make real quick before we let you guys get back to your day. Just want to talk about some upcoming events we have. Mr. Charlie Tiger put in the chat here some information about the Bellevue Community Fund Give Back Program. September 25th is going to be at Honey Fire Barbecue at One Bellevue Place, and 10% of all of the money brought in from sales that day will be donated to the Bellevue Community Fund. And we are going to be sending out an email about that very soon. We also have October the 1st, which is our first Thursday at 9 a.m. and noon. We have ChamberConnect, which is our online networking group. We'll be sending out some information about that. But if you want to be part of that great activity, go ahead and put that on your calendar. It's a lot of fun and a great way to get to know the other business professionals in the Bellevue area. We also will have Breakfast Before Business coming up on October the 15th, and we'll be putting out some information about that as well. And 2 really important things I wanted to mention before we go is our e-commerce store. We have some great Bellevue merchandise that we are going to be selling online. That is going to be launched on Saturday. It's up and running already on our website. If you go to BellevueHarpethChamber.com and click on online store, you can see that information, but we're going to push it out hard on social media just after a few more tests are done to make sure everything is going well, which it is. Everything's great. So you can go ahead and online order now if you'd like. And the other thing I want to talk about is if your business would like to partner with the chamber through our Chamber Heroes sponsorships. I would love to talk to you about that in more detail. We have a great opportunity to help you get the word out about your business through Chamber Heroes. That information is on our website at bellevueharpethchamber.com. And our phone number at the Chamber is 615-662-2737. And you can always reach out to me via email as well at anapoli@bellevueharpethchamber.com, because we would like to work with you on that. And before we close out and let you guys get back to your day, Jim, did you have anything you would like to add?
How to add how to unmute. No, I just wanted to give special thanks again for Dr. giving us your time in such an incredibly busy time that you're going through, and to thank the board members and team members of the Chamber who give their time voluntarily to create programs like this to continue to drive value. And lastly, to thank our sponsors who help pull all that together. We're grateful for you. We're honored to have you as a member of our organization. And we look forward to serving you throughout this time. Tough time, great opportunity as well. Come together and we'll all be stronger. Thank you.
That's exactly right, Jim. And yes, just thank you to our sponsors. Thank you to Nashville Christian School again for being with us today. And if you have any questions about anything that you saw today, you can reach out to us, and it's also on our Facebook Live feed. So have a great afternoon, everyone, and be safe. Wear your mask.